Hello, I'm Dr. Max Gomez, and we are at the Fifth International Vatican Conference. And today I'm joined by Joseph DeVivo from Teladoc. And welcome, Joe. Thank you for helping us out today.
Thank you for having me, Dr. Gomez. It's a pleasure.
So let's start out first with, before we get into a little bit about digital medicine and telemedicine and so forth, so many of the conferences that we all attend, uh, including yourself, I'm sure, tend to be kind of one dimensional, sort of one topic, one organ, one disease, or so forth. What do you think is unique and valuable about this kind of Vatican conference?
Well, I think what's unique about the Vatican Conference is that the mission is so great. And it's not about each of our swim lanes and our specialties. It's about humanity and it's about thought. And in order to get the best thought and the best answers, you need to listen to peers that have perspectives that overlap yours and also potentially even contradict yours, because it's important to have a wide variety of thought and perspective because the goal is very high.
We don't all have to agree, but it gives us something to think about and work on, right?
Exactly.
So, Joe, some of the things that we keep hearing about how the digital revolution is going to revolutionize medicine, but tell me how that impacts healthcare. It seems that we're able to move healthcare out of the hospital, out of the doctor's offices, and into a much more, for lack of a better term, retail setting.
Absolutely. Well, digital has been impacting many industries prior to healthcare. We've seen what's happened to retail. We've seen electronic banking, and the capabilities are, it's simply efficiency. It's simply leveraging the assets that you have across boundaries. It's about convenience and customer care, and patients deserve that too. In a healthcare setting, it doesn't have to be inconvenient. It doesn't have to be inefficient, and it doesn't have to be too costly. And by just as many other industries have seen a revolution in digital address many of these issues on cost and access and convenience and preference. When it comes to your health, it's something we all live with every day. And it's something that with digital, you can engage your health. You can take involvement in understanding your data and changing your behavior and having ways to monitor your activity that drives the right behavior, instead of just going and seeing your GP twice a year and being told that your blood pressure is continuing to rise. So it is time to usher in a change in healthcare. And I think this, especially this generation who is growing up digital, it'll only demand that type of service in the future.
Clearly, the COVID-19 pandemic has been sort of the pedal to the metal, as it were, for telehealth. Um, but there's the missing link in there for a while had been reimbursement for
Mhm.
that. Talk about how all of those things have now come together.
Well, Winston Churchill once said, never waste a good crisis. And this crisis has been a catalyzing event because it was simply for healthcare about a survival of a patient to receive care, about creating safety zones for healthcare workers so they can interact with patients in a remote basis, but still provide them care. And it's been existential because health systems and the hospitals in general wouldn't be able to treat remote patients without virtual care because no one wanted to have that physical interaction. That catalyzing event has shooken the institution of healthcare and has forced us to rethink policies and thoughts that were just simply wrong, to be quite honest. On a reimbursement side, it was believed that virtual care would increase costs because someone would get their phone and say, call a doctor. I want every day they would ask for a doctor. They would over consume healthcare. The data has actually shown that with the incredible increase in consumption of healthcare based upon this need, that they didn't increase their individual consumption more than they would. People will put off going to a doctor because it's too difficult to get into a doctor versus being able to get an appointment at the right time when you need it and then be done. So whatever is ailing you doesn't persist and cause more expensive, more complicating events in the future. So virtual care and digital is a way, and this crisis has created an opportunity to see the world in a different perspective.
And I suspect virtual care is here to stay. Joseph DeVivo, thank you so much for your perspectives today. It'll be interesting to see how it all evolves.
Thank you, Dr. Gomez.